For the best possible results, how far would you travel? Would you take an international flight to find a hospital that ranked among the very best in the world for the treatment of heart attacks? For the best possible results in 9 cardiac care measures, just how far would you go? St. Tammany Parish Hospital, world-class healthcare, close to home.
Welcome to Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton. Today we have 2 guests here from St. Tammany Parish Hospital Outpatient Palliative Care Clinic to give us a little information about what exactly palliative care is and what it can offer patients in our community. Our first guest is Dr. Agustin Suarez. Welcome, Dr. Suarez.
Thank you. Thank you.
Can you first give us a little bit of information about your background?
Okay, well, I can start with, I went to medical school in Spain, and then I came and did internal medicine internship and residency at Charity Hospital in New Orleans. And then I went to San Antonio to the Health Science Center and did a fellowship in hematology and oncology. And then I went into practice, and I have been in St. Tammany probably for about 32 years. And it has been very rewarding because we have been able to start all kinds of programs. And then lately, about 3 years ago, the hospital asked me if I could start a palliative medicine inpatient program. So I hesitated, but and I told him, I'm not sure it's going to be successful, but we are going to try, and do not condemn me if it's not if it doesn't go anywhere. So it has been really a blessing for me to be here in St. Tammany Parish, and lately basically St. Tammany Parish Hospital. So because of the nature of what I'm doing at St. Tammany Parish Hospital, and there is a lot of interrelationship with oncology and the other oncologists, I decided that I was not going to practice hematology oncology in Covington, so that no other oncologist would think that I am, in competition with them, because basically what I'm doing now is palliative medicine. Okay. And basically, if anybody needs to know what palliative medicine is, and obviously, right, whenever I go into a patient's room and I introduce myself as the medical director of palliative medicine, invariably they say, what's that?
That's exactly what I was going to ask. Can you please explain what palliative medicine is?
What is that? So, to me, the essence of palliative medicine is compassionate listening, compassionate care. Okay. And so we see patients that are seriously ill. They have a serious illness that most of the times leads to their demise. Not necessarily they are going, it's not like hospice, there is nothing else to do but just comfort. In palliative medicine, we have a big range of time where the disease process changes. And so the patient and the family are met at different points of their disease process where they have to make serious decisions and where they have to be comforted, where they have to be educated, where they have to be listened to. And so, we don't only see cancer patients, but we see patients with end-stage dementia many times.
Okay.
And we see patients with end-stage pulmonary disease and end-stage heart disease. So all these illnesses that ultimately are going to get worse. So we try to prepare the patient and the family along the way before they have to make a decision that is serious.
Okay.
So that we would like to not have to actually see the patient at the end of their life when they are going to make decisions where the family is all confused because they don't understand the disease process and where the patient is going.
Okay.
So we're trying to educate and support and treat certain symptoms along the way.
Okay.
So that they understand and they make the right decisions for the patient.
Right. So you intervene a lot sooner than hospice would, or some
Yes.
that maybe beforehand.
Definitely, and that's the reason why it was important to have an outpatient palliative medicine clinic. You see, because when you are seeing patients in the hospital, they are usually in crisis.
Right.
And so there is a lot of emotion going on with the patient, with the family members, and many times the patient is so ill that the patient cannot make decisions for him or herself. So we have to basically acquiesce that decision to a member of the family, either a spouse or a sibling or a child. So that's the reason why we have the outpatients, so that we can start earlier in less stressful environment, less stressful situation, to explain what the disease process is and to listen about their worries, about their friends, their relatives, and the community as a whole. What social situation, what psychological issues they might have that needs to be discussed.
Okay. And so does this usually help keep them from ending up in the hospital? And
Yes, many
times.
times that is the case, although they will always have a choice to go to the hospital. But if they go to the hospital, it's for a definite goal and
Right.
not something, well, you're sick and then you end up at the hospital and you don't know what might happen. And so it's a very confusing picture when you are not prepared and you don't really know what to expect
Right.
of the progress of that disease. you
Okay.
see.
And you mentioned that you started out as an oncologist and that you practice
Right.
that as well. Can you tell me how palliative medicine is different from oncology?
Well, when let's say when I practice oncology, okay, and I have to say that I do not practice oncology in Covington.
Right.
I focus on, obviously, on the patient, their needs, but I mainly focus on treatment. And there are so many changes and so much knowledge out there that as an oncologist, you focus a lot of your time into treatment options and to learn how to treat the patient for the best of the patient. You see, so many times you really don't have time to go that deep and see what other stressful situations the patient might have, because we are focusing on the treatment of the disease,
Right.
you see. And so and palliative medicine, we work as a team, you see. So the patient has social issues, we work with the social worker. If the patient has some spiritual issues, we depend on the chaplain. If they have medical issues, we depend on the oncologist or the cardiologist or the pulmonologist to guide us in that. So basically, we're trying to look at the patient as a whole,
Right. Okay.
and try to put everything in perspective for the patient and for the other physicians and the medical team that is taking care of the patient. So there is a lot of communication.
Okay.
Is a lot of communication. So that's why I say, palliative medicine to me is compassionate communication.
Right. Okay.
And I say compassionate because, the patients, when you're having a serious illness, you are very focused. You know when somebody is talking to you, whether they are really sincere or they are just following a protocol.
Right.
So anybody that goes into palliative medicine, that is one of the qualities they need to have. Basically, a lot of compassion.
Compassion, willingness to listen, and to
Exactly.
treat. So y'all treat the whole patient. So y'all can treat
Right.
medical, physical symptoms, as well as the emotional,
Yes.
social, and those type of things.
But when we're dealing with, like for example, we treat oncology patients that have pain issues.
Right. Okay.
However, we do not treat chronic pain, because that is a completely different population, and really I don't feel that I am prepared or know enough to treat patients with chronic pain.
Right.
That's a psychological issues, social issues, and I don't think that I am.
Right, but you can help treat the symptoms of the larger disease.
Yes.
As a whole, and manage the symptoms.
And not only that, I think, like I said, if the patient has problems with their congestive heart failure, the first thing I'm going to do is I'm going to call the cardiologist and explain what the patient is experiencing, so that he or she could tell me what to do with the patient, or if he or she needs to see the patient at that particular point.
Okay.
You see?
Perfect.
So it's trying to put everything together so that the family and the patient know that everybody is really helping
Got it.
as a whole, as a unit. So.
Well, thank you very much. I appreciate that explanation, and you kind of explaining something that I feel like is new to a lot of people.
But I hope that has been a little bit clearer.
Definitely.
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 So, and I thank you.
Thank you.
For having me here.
Awesome. Thank you to Dr. Suarez for being here today. And up next, we have Shirley Timmons, a nurse practitioner that works with Dr. Suarez in the St. Tammany Parish Hospital Outpatient Palliative Care Clinic.
The North Shore. It's our place, where finer things are sometimes the simple ones. Social, sweet, and spirited, but always in harmony. Around here, life is about great things coming together. St. Tammany Parish Hospital and Oxnard, collaborating in the name of community.
Welcome back to Healthy Living, brought to you by St. Tammany Parish Hospital. Our next guest is Shirley Timmons, nurse practitioner at the Outpatient Palliative Care Clinic. Welcome, Shirley.
Thank you.
Can you first give us a little bit of your background?
Sure. I became a nurse late in life. I had always wanted to be a nurse, and I finally did in my 40s. And I worked on the floor at St. Tammany Parish Hospital in telemetry, medical surgical, just regular floor to get experience, and was drawn to hospice care, worked as a hospice nurse for 7 years, and just had a real affinity for helping in such an elemental way for people. And liked it so much that I went to graduate school and became a nurse practitioner, and worked over at Ochsner main campus doing palliative care for 4 years, and then came back over near home. I live right near the hospital, so it's very, it's a real win for me to be able to work at St. Tammany.
Awesome. Well, I know you work with Dr. Suarez at the Palliative Care Clinic, and you said you also worked in hospice. Can you kind of tell us what the difference is between palliative care and hospice?
Yes, big question.
Right.
Because everyone confuses the two, and many people think that palliative care is hospice. At St. Tammany, we're separate departments, and palliative care is really an umbrella term that describes any care devoted to quality of life for people with serious illness. So hospice certainly falls under that umbrella, but it is the type of palliative care provided at the end of life. And the rule of thumb is that your doctor would not be surprised if you died from the disease that is taking your life within 6 months. Okay. That doesn't mean that people need to die within 6 months or that they won't live longer. Some people don't live that long. Other people live quite a bit longer with hospice, and in fact do very well with hospice. But our service could be considered upstream. So we come in before people it's been determined that they're in a terminal stage, and hospice is after that determination's been made.
Okay, so it's they know they have a terminal illness, but it's not happening yet.
Yeah, they have an illness that has the potential to take their life, and probably will, but we're not there yet. And hopefully there's a lot we can do to help people feel as normal as possible as they go through treatment.
Okay, and so since this is kind of a newer thing, why has it become something that hospitals feel are so important, especially to offer inpatient and outpatient palliative care?
Well, the way modern science is, modern medicine is just so amazing, and what we've been able to accomplish in keeping people going and treating advanced illnesses, that patients and doctors alike, I think, have started to feel like there's always something else we can do. There's always one more thing we can offer. There's always something we can do to extend life. And in some cases for people, extending life is no longer an attractive thing because quality of life suffers so much. And so, what we end up having is people who are chronically, critically ill in the hospital getting, Hail Mary therapies when God is ready for them. And, we will try to help people look at the big picture, and we support what people think is what is actually the most important thing to them. Okay. So, we will talk with families about, say if mom or dad has advanced dementia and they have pneumonia again and they're in the hospital again, we talk with them about what this person would want if they were healthy and able to speak for themselves. And so the hospital, a lot of care that's provided at the very, very end of life tends to be sort of crisis care, and it is very expensive care, and it doesn't really buy the patient the kind of quality that we would hope for. So the hospitals want us to come in and make sure that whatever care is provided is really appropriate and desired.
Right.
So
from the outpatient side of that, y'all are trying to come in even before they end up in that crisis situation,
Definitely.
Before they end up in the hospital, and kind of manage their care that way.
For sure. And a lot of times when people come in the hospital and they're in crisis, we will visit them in the hospital. We have a inpatient consultation service, and if things aren't going the way that everyone hoped they would, or if symptoms are out of control, or if people feel like they need to make sure their family understands what they're feeling, we will be consulted to see them in the hospital. A lot of times people in the hospital feel like they're overwhelmed, they've got 5 specialists treating them because they've got 5 illnesses or one illness with a lot of organ involvement, and they don't know what's happening and they don't understand what the doctors are telling them. And so we will come in and try to translate, I guess, and try to make sense out of things and make sure that what they wish for and what they're thinking is always in front of their medical team.
Okay.
Yeah, so we're advocates for what they're, make sure they understand what's happening, all their decisions are truly informed, and like that. So having said that, we'll have people we see in the hospital who are referred to our outpatient clinic afterwards, and then we follow them along.
Okay.
And some people will be getting chemotherapy, other people are in pulmonary rehab, it just depends on what their problem is, and we just follow them for symptom management, and if they have a setback, we'll have a talk about how they want to proceed.
Okay.
Yeah.
And so what kinds of services do y'all offer to patients in outpatient palliative care?
Outpatient palliative care, we do symptom management. So pain, Dr. Suarez mentioned pain. We treat pain, nausea, anorexia, insomnia, anything that has anorexia from their disease, not anorexia nervosa.
Yeah.
But anything that has the potential to make them miserable and not function well is what we want to fix for them. And we do that in collaboration with their regular doctor. So we don't interfere with what the plan of care is with their regular doctor. We don't interfere with that relationship at all. In fact, it's not unusual for us during an appointment in the outpatient clinic to be on the phone with other providers and make referrals that we think are going to be especially helpful for the patient.
Right. So it's really, it's about, I know Dr. Suarez mentioned compassion, but it's also about collaboration.
Definitely.
That way, because I know oftentimes we talk about this with cancer where you have so many different doctors, and now we have these multidisciplinary teams where they're all talking to each other rather than talking to the patient separately. And I guess this is kind of similar for that type of care. It
is very much. And we also will help if a person feels like their wife doesn't understand or their kids need to be brought up to speed, but they don't know how to tell them. We facilitate that and try to make sure everybody's on the same page and the patient has the kind of support they need.
Okay. So is this something that is a physician referral? Is this something people can self-refer into?
It is a physician referral. And in the hospital, if a patient is in the hospital and they think, oh wow, that sounds like it would really help me, they just need to tell the nurse, and the nurse can facilitate that for them, or their doctor.
Okay.
But usually the nurse is the one who has contact with all the doctors and knows which one to ask.
Right, okay.
And if you're outpatient, same thing, you just ask your treating physician. If you're a cancer patient, ask your cancer doctor. If you're a heart patient, ask your heart doctor, and they can refer to us.
Okay. And the clinic is located near the hospital?
Yeah, we're just a couple blocks away. We're at 1010 South Polk Street, corner of 12th Avenue.
Okay.
Very easy to find.
And is it just you and Dr. Suarez? Do y'all see patients together? Do y'all see patients separate? How does that work? Like if somebody's coming in for an appointment, how does that work?
We usually see them together. And it's not, we also have Dr. Maria Mahoney, who sees patients on Wednesdays. And we also work, our clinic hours right now are Monday, Wednesday, and Thursdays. And we see them together as much as we possibly can, because two heads are better than one, and one of us might have a perspective that the other isn't thinking of right at that moment, and it's helpful for everyone, I think. But we can and do see people by ourselves, but we like to know each other's patients.
Right, so that it's all about the collaboration, right?
Yeah.
Perfect. Well, thank you so much for being here. I appreciate it. I'd like to thank Shirley and Dr. Suarez for being here today and giving us some great information about palliative care and what it can offer patients in our community. This has been Healthy Living, brought to you by St. Tammany Parish Hospital. I'm your host, Amanda Paxton, and we'll see you next time.